Hello, everyone, and welcome to another episode of NSD Mental Health Talk with Dr. Lola. Today, I will be talking about antidepressants and how to select the right one for you. So, let's get to it. There are different types of antidepressants, and selecting the right one can be tricky, but let's get into it. There are particular symptoms of depression can vary. One antidepressant may relieve certain symptoms for one individual and not for the other. So it's very important to discuss your symptoms with your doctor. For instance, if you are struggling with sleep, antidepressant that might be beneficial might be something like trazodone. If you have pain with your symptoms, something like Cymbalta might be considered. If the antidepressant, if the symptoms reported has a lot to do with anxiety as well, alongside with the depression, Zoloft might be an option. So it's very important to discuss your symptoms clearly with your provider so they can select the right medication for you. Side effects of antidepressants vary from one medication to another and from person to person. People report dry mouth. Again, it's very important to keep hydrated while you're on this medication to prevent headaches. And, sometimes when the water or hydrating with water is not enough, using candy, sugarless candy might also be an option. Some people struggle with weight gain when taking antidepressant. So if weight issues is a major concern or sexual side effect, then your provider might consider something like Wellbutrin instead of something like Zoloft or or other SSRI. So it's important to discuss what the what your major concern is so they can select the right medication for you. Again, it's very important to also report to the provider if any of your family member has tried any antidepressants in the past. Fourth degree relative is very important, like parent or your sibling. If you know what medication has worked for them, the possibility that the medication will work for you is very likely. So you want to make sure you report that as part of the social history when you're talking to your um, provider. Also, you want to make sure you have a list of the other medication you're taking at hand, because some other medications you're taking might interact adversely with the antidepressant. If you are pregnant or breastfeeding, you want to report that as well. The risk for birth defects and other problems for babies of mothers who take antidepressants during pregnancy is low. However, certain antidepressants like Paxil may be discouraged during pregnancy. So please make sure you report if you're pregnant to your provider. Also have the last date of your menstrual cycle at end if you are a female. That is also very important. Um, Other health conditions, you want to make sure you report that as well. If you're struggling with any other mental or physical conditions, please report that so the right medication can be selected for you. Again, things like Effexor may relieve symptoms of anxiety disorder. Wellbutrin may help you stop smoking, alongside with um, helping. I mean, with the side effect of reduced weight and things like that. So it's very important to let your provider know what your other physical or medical conditions are as well. We talked about Cymbalta. It helps with pain. It helps with things like fibromyalgia. Elavil helps prevent migraine. So you want to be very mindful and discuss this with your provider. Also, the cost and insurance also plays a part. So sometimes, switching from generic version to the trade version and things like that can help to minimize cost. So again, the provider might be able to see what is popping up from their hand when they type in the medication, what it's gonna cost you. They will let you know, and if they need to switch to a generic version to help minimize costs. So make sure you discuss with your provider. There are different types of medication, antidepressant. There is what we call SSRI, or selective serotonin reuptake inhibitors. Again, most times, this is the first line treatment and the management of depression. The medications generally cause some fewer bothersome side effects, and they are likely to cause problems at higher therapeutic dosage than other types of antidepressants. So SSRIs, things like Prozac, Zoloft, Paxil, Celexa, Lexapro are usually like the first choice because they have lesser side effect. The other category is what we call serotonin norepinephrine reuptake inhibitors, SNRIs. They include things like Cymbalta, Effexor, um, Prestige. So these are some of the SNRIs that can also be considered. A typical antidepressant, again, Wellbutrin. Wellbutrin not only helps with depression, but it also helps with some symptoms of ADHD. So if a patient is struggling with focus issues, this is a good choice for the patient, and if they also struggle with depression, again, some other physical conditions may or other mental health history like history of anorexia and things like that may prevent a prescriber from prescribing this medication. But it's very important to take a thorough history and let and the patient be honest and let the provider know what the symptoms are and or the history so the right medication selection can be made. Tricyclic antidepressants like tofranil, pamilol, naproxen tend to cause more side effects than new antidepressants, so they are less prescribed. We also have the monoamine oxidase inhibitors as well, Nadil, Panade. Again, they may be prescribed, but often when other medications haven't worked, they are not the first line option in the management of depression because they can have serious side effects. Using MAOIs or monoamine oxidase inhibitors requires a strict diet, which most patients struggle to comply with. Things like avoiding cheese, pickles, wine. So it's very important to discuss with your doctor, but they are not the first line treatment in the management of depression. The other medication can also be combined with antidepressants if the patient is presenting with either paranoia, they might have a low dose antipsychotic, or the presenting with mood issues, mood swings. Again, adding a low dose antipsychotic or other mood stabilizers to the patient's medication regimen might be appropriate in that instance. So it's very important to let the provider know what the symptoms are and the history as well. So please, please, please be patient. Once you and your doctor have selected the right antidepressant, it might take some few weeks before you start to see improvement. So some people start to see some improvements within a week or two, but most effectiveness is seen 6 to 8 weeks in. So please try and be patient. Again, it might take some few weeks or even months sometimes to find the right dosage for the client. Remember, it's very important to start slowly sometimes because you don't know how the patient will react to medication, most especially if the patient is medication naive. They've never been on medication before, so starting slowly to see how the patient react, because some antidepressant might also induce suicidal ideation. So it's important to start slowly and go from there. So again, the dry mouth can be combated with drinking lots of water, sugarless candy. Nausea is very important. When you take your medication, do not take on empty stomach. You want to make sure you're taking your medication with food. If you don't feel like eating breakfast and you have to take your medication in the morning, dry crackers is one that can be considered. Also, you can also consider things like yogurt to coat your stomach lining if you don't have lactose intolerance and things like that. So these are things you want to put in place before you take your medication, because taking your medication on empty stomach is not a good idea. um Headache, a lot of water is also important. Some people report insomnia with their medication, and at that point it might be important to switch the timing of the medication. Sometimes when the patient takes the medication at nighttime, it might cause more insomnia than when they switch to morning. So sometimes playing around with the dose might help. It depends on what medication and the individual patient. So discuss with your doctor. Switching times or adding a second antidepressants might be needed in some cases, not in all cases. Psychotherapy is also a good one. Talking out your concern, your going for a talk therapy, addressing the underlying issues is very important, because the combination of the medication and psychotherapy will give the full effectiveness. So it's very important to combine both, and also to be compliant with treatment, not just show up this month, then the next time you show up is 6 8 months down the line. You want to try as much as possible to be compliant with treatment. Do not stop taking your antidepressant without talking to your doctor. Some medications will need to be tapered down to prevent withdrawal symptoms. So please talk to your doctor. Avoid alcohol and recreational drugs while you're taking this medication. If you take alcohol with your medication, alcohol is a depressant. So again, you might still be having increased depression, and again, you don't want to combine alcohol with your medication as well, because it can decrease respiratory rate and stop breathing, and so definitely a safety concern. But if you want to make sure the timing is way. So if you're taking your medication in the morning and you're taking just a glass of wine in the evening, that is different than taking a glass of wine in the evening and taking your medication right afterwards. So be mindful of your lifestyle as well, and because some people come in and wonder why the medication is not working, it might be due to your lifestyle as well. So you want to manage that. Recreational drugs, marijuana and other recreational drugs might interfere adversely with your medication. Again, we talked in the last video about the potency of the marijuana and cannabis that is found on the street. It might have more potency. In the past, it was 4%. Now the potency of the marijuana found on street is like 15%. So this will adversely affect your medication, causing neurochemical imbalances and making the medication ineffective. So if you're wondering why your medication is not working, it's also very important to examine your lifestyle. In the last video, we also talked about caffeine for people that struggle with anxiety, because increasing your caffeine intake, or increasing your caffeine intake, can definitely affect your mood adversely as well. So just be mindful. Lifestyle changes, including exercise, it helps to get rid of the negative and negative energy. It helps to release endorphins, and it helps you to feel much better. So you can also do some lifestyle modification to see how your medication would start working positively and to your benefit. Well, I hope this video has been helpful. Thanks for joining in, and if you have already subscribed to our video, I thank you. I hope it's been helpful, and I look forward to speaking to you the next episode. Information is down below. Do not forget to subscribe. Again, my name is Dr. Lola with NSD Mental Health Services. Thank you and have a good weekend. Bye.